They're just underneath the skin, so they're tense under there, so if I just rub like this, I rub all the capillary blood out of the way over those tendons and it turns white briefly. That's blanching. So that's, and you just rub across there, and when they blanch, it's easier to see them transiently. So that's extensor digitorum, extensor indicis, and extensor digiti minimi. Those are the extensors of the fingers. Okay? That just leaves our thumb, and the only ones that we palpated were extensor pollicis longus, extensor pollicis brevis, and abductor, abductor pollicis longus. So we have Mallory bring her thumb up like this, like she's going to hitchhike. The one that's more towards the ulnar side, this nice long tendon, is extensor pollicis longus. We come around like this to see extensor pollicis brevis. And then in the same tendon sheath with brevis is abductor pollicis longus, and if you go right there, hers is absolutely gorgeous because you can see it. There's abductor pollicis longus. She doesn't really even have to abduct to get it. Okay? Rotate your thumb around a little bit, and it disappears, comes back, disappears, and comes back. Hers, the reason we can see them so well is they separate early to go to their points of attachment. In a lot of you, they're in the same compartment, the same tendon is slit, and they don't want to come out until way late, just before they attach. The proximal one does.
It's kind of grody.
But that's actually kind of cool.
I can like feel it rolling on my bone.
Mm-hmm. So the literal walls of the anatomic snuff box are the tendons for extensor pollicis longus and brevis, and then the floor of that's the scaphoid, the bone. Okay? So I think that's all of them, right? That we could palpate, or that we did palpate in lab.